Good evening, Director and Council members. Thank you for the opportunity to update Council and the community on the activities of the Delaware County COVID-19 Task Force. The Omicron variant, first identified in South Africa, has become the new focus in the pandemic. To date, one case has been identified in the U.S., a traveler from South Africa to San Francisco. The unprecedented number of spike mutations identified in this variant has the potential to impact the trajectory of the pandemic. It is too early to know the risks posed by Omicron, whether it will be more transmissible or resistant to vaccines. The best defense against this variant are the COVID-19 vaccines currently available. The message remains to get the vaccine or a booster if you are eligible. The most recent Pennsylvania Department of Health data for Delaware County is trending upward across most indicators. Newly reported cases have risen from 668 to 774 in the most recent 7 days. Incidence rate per 100,000 has increased from 117.9 to 131.3. Average daily COVID-19 specific hospitalizations are also up from 26.9 to 33.7. It is important to recognize that the dominant variant circulating in our region is the Delta variant, and the current vaccines are working to limit hospitalization and death for those who are immunized. In response to the Omicron variant, our Delaware County vaccination clinics have been full, many individuals coming for booster dosing. To date, there have been over 735,000 vaccines administered in the county, with 70.7% of our population receiving at least one vaccine dose. 59.2% of the population are fully covered, and 11.4% are partially covered. Over 64,000 additional third doses and boosters have been administered in the county since August 13th of this year. The Pfizer pediatric vaccine rollout has been successful, with over 400 vaccines delivered in our dedicated pediatric clinics and over 1,700 doses transferred to local pediatric offices. It is important for families to recognize that COVID-19 is not always a benign disease in childhood. To date, over 8,300 children have been hospitalized with at least 94 COVID-19 associated childhood deaths. Approximately 1/3 of hospitalized children aged 5 to 11 require ICU admission. Multi-system inflammatory syndrome, a condition where different body parts become inflamed, including the heart, lungs, brain, skin, eyes, and gastrointestinal organs, has been reported in 5,217 children since the start of the pandemic, 44% in children ages 5 to 11. Like adults, children with underlying conditions such as asthma, diabetes, sickle cell disease, or immunosuppression can also be at increased risk for severe illness from COVID-19. And it is important to recognize that asymptomatic infections are responsible for about 50% of community transmission. Pfizer pediatric COVID vaccines for the 5 to 11-year-old population are now integrated into our Yeadon and Chester vaccination clinics. We continue to offer all 3 booster shots to everyone 18 and over at all regular vaccine clinics and events. We also continue to offer Pfizer and Moderna third doses to immunocompromised individuals. Throughout December, community COVID vaccination events are scheduled at the SEPTA 69th Street Terminal, the Haverford Community Recreation Center, and the Pfizer pediatric vaccine clinics will be held at the Haverford Township Building, the Aston Community Center, Delaware County Wellness Center, and the Keystone First Wellness Center. Final flu clinics are scheduled at the SEPTA 69th Street Terminal and the Delaware County Wellness Center. COVID testing will continue at the Delaware County Wellness Center in Yeadon on Mondays and at the Keystone Wellness Center in Chester on Wednesdays. The delcopa.gov website posts dates and times for all vaccine and testing clinics in the county. The Delaware County Wellness Line is also available weekdays 8:30 to 4:30 for COVID questions and any health-related concerns. That number is 484-276-2100. In closing, The Omicron variant reinforces the case that we all need to get immunized and, if eligible, booster shots. If we are protected with vaccine, we have a chance to disrupt COVID disease transmission and the mutations that arise. Our current vaccines are working. We must protect our progress. Thank you for your time and attention. I am always available for questions.